Hello, I'm Dr. Andrew Sinclair. I'm a health psychologist who works at Independence Australia and have worked with polio survivors and people dealing with the late effects of polio for over 10 years.
And hello, I'm Jenny Coadlo. I also work at Independence Australia as a clinical psychologist. And not only do I work with people with disabilities, I also have been working with family members and the social effect that the disability can have.
How you feel about your body image and how your body functions is really important for people with polio. And while many polio survivors have a positive self-image and sense of themselves, some can develop lasting negative feelings about how their body looks and how their body feels. And this can include distress about aspects such as their height, asymmetry in how their body looks, how differences in strength, particularly weakness, but also in function and how they move around. And this can negatively impact on self-esteem, relationships, and in the things that people go into in their life that in terms of career and other things that they might like to do.
So self-esteem is about how you view yourself, whether it's in terms of your body image and also how you view yourself within. And that can be impacted significantly in terms of how you're comparing yourself to other people. The things that are said about you and the things you say about yourself. The expectations that you've put upon yourself.
And for people with polio, there's two aspects of body image that's important. One is static body image, and that reflects how a body looks and the appearance. But of more importance is kinetic body image, and that's the body image about how we feel about how our body functions and moves. And some of the most negative aspects on our mental health reflect upper body weakness and differences in appearance, because they're often the ones that are most noticeable for others, such as an inability to engage in a firm handshake or affecting our desirability in terms of how attractive we feel to other people. So that kinetic body image and upper body image is really important aspect in terms of our mental health and can affect people with polio.
However, a positive body image can also assist us in adjusting to a disability.
So most people with a physical disability will achieve a good sense of their body image over time. But there are some things that if you attend to can help that process along.
One of the things is recognising that a perfect ideal body is actually unrealistic for most people, and that to remind ourselves that there's an incredibly wide variety of body types and function.
And people who develop the best body image recognise that it's more about our intrinsic worth as a person than how we look in terms of our sense of ourselves. So placing value on personality characteristics, such as being warm or funny or engaging, rather than how your body looks to people, are going to improve the way you feel about yourself as a human being.
Attractiveness is about being in the world.
And finally, recognising that assistive devices like wheelchairs and crutches, and looking at them in terms of how they enable you do more in your life rather than as a symbol of what you can't do. So there are some places that you can go to get help. One of those would be to see your GP. They can help you access a psychologist through the mental health care scheme.
And it's important to talk to family and friends. Look for other support groups like a polio support group in the community.